Welcome back to Midweek Politics. I'm David Pakman. Joining us is Dr. Robert Levine. Is it Levine or Levine, Doctor?
Levine.
It's Levine. Thank you so much for calling in. He's the author of Shock Therapy for America's Healthcare System, has a neurology practice in Connecticut. Thank you so much for calling in today.
Oh, you're welcome.
So how did you decide you wanted to go to medical school, first of all? I always like to ask.
I can't remember. It was too long ago.
But you're glad you did.
Absolutely.
But do you remember what portion of the people that started with you never made it through?
Oh, pretty much everyone did.
Everyone made it through.
About 95% made it through.
Well, that's a good track record, it sounds like.
Right.
So let's talk a little bit about healthcare in the U.S. You say in your book that the U.S. spends more than any other country on healthcare. Is this in absolute dollars, or is it as a percentage of the total economy?
Both.
It's as both. So
it's both per capita. It's both total outlay, and it's as a percentage of percentage of the economy.
And are there any situations where that would be okay? That is, if we were getting the absolute best care in the U.S., maybe it would be okay to be spending the most. But I don't know. Is that the case?
Well, first of all, we're not getting the best care. But even if we were, we can't afford to spend the kind of money we are right now. It's just not sustainable. When I went into practice back in 1970, the average per capita costs were $356 a year. It's up to $7,500 now.
Well, but we have to adjust for inflation, right?
But if we adjusted for inflation, it would probably be about $2,000.
Right.
I mean, it's still just astronomical. And it was originally 7% of the GDP, and it's now 17.5%, and it just keeps going up and up and up.
So what statistics can we point to that really clearly indicate that we're not getting the best care, meaning infant mortality, life expectancy? What to you are the most telling facts and figures?
Those are two of them. Of the developed countries in the world, our life expectancy and our infant mortality are the worst.
I'm sorry, go ahead.
No, they're by far and away the worst. Also, in what's called preventive mortality, we're among the worst also. We're just not producing good care. But in addition to those, there are a lot of people who say, I have great health care. I'm really happy about my doctor. I'm happy about the insurance I have. 30% of the care that's given in this country is unnecessary. That means people are having unnecessary operations, unnecessary procedures, unnecessary tests. They may be happy with the care that they're getting, but they're getting too much. And when they're getting too much care, that means there are side effects. That means there's mortality, medical injuries that are unnecessary.
Well, as we were talking about before the break, this doctor who gave the Republican response to Barack Obama's speech, Dr. Charles Bustani, he was on the bad end, so to speak, of a malpractice suit where he performed both unnecessary and debilitating heart surgery on an individual in Louisiana. So are those when you say too much care, what are some examples of that?
Well, there's 1.2, let's see, 1,200,000 angioplasties done every year. That's where they do cardiac catheterizations and put stents in.
Right.
It's an invasive procedure. It has a certain risk associated with it. The estimates are that 500,000 of those are unnecessary.
500,000 out of 1.2 million.
Right.
Which is almost half. That's an incredible
well,
number.
It's not almost half, but it's probably 35-40%.
Right.
So that's a significant amount.
No.
Now, I don't want you to think that unnecessary care is all driven by physicians doing unnecessary things,
right?
Because of the profit motive. That's a big thing. The fee-for-service medicine leads into that, but a lot of it is also on the basis of defensive medicine.
Right.
People are doing extra tests and procedures because they're afraid of being sued. And even though I think we have to get rid of the incentives that doctors have to do these extra tests and extra procedures, we also have to have malpractice reform. So there's something that has to be done that the Republicans don't like, and there's something that has to be done that the Democrats don't like.
Well,
and neither one of them want to give way.
Right. So, some have said, including John McCain during his campaign, that the direction that healthcare needs to go in is towards a free market solution. Let people buy their own healthcare. We'll give them a tax credit, get the employers out of it. That would improve overall the picture.
I disagree. We've had a free market system for the last 60 years, and our costs keep escalating and escalating. It's not going to do anything to get rid of the incentives that doctors have to increase care. And it's also not going to get rid of the administrative costs, because when you have more and more insurance companies in competition, it increases the administrative costs. The administrative costs right now are estimated to be between 15 and 25%. If we take an average of 20%, that means we're spending $500 billion a year out of our total health care costs of $2.5 trillion are just going for administration.
What would be to you an acceptable number to be spending on administration?
Well, probably half that would be reasonable. Medicare costs are supposed to be in the single digits, mid-single digits to even low single digits. But I think reasonably we could probably have a healthcare system that had 10 to 12%, and that would be reasonable. We could save $250 billion just by switching to a single-payer system.
So your big thing...
We don't want a single-payer system that's socialized medicine. It doesn't have to be under the aegis of the government. It could be done under an independent agency like the Federal Reserve, where politics would not be interfering with healthcare.
When we think about the problems that we hear detractors of a single-player system state, and this includes everything from if you haven't been sick long enough, you have to wait for years for care. Hospitals and emergency rooms are completely overcrowded. No one gets good care instead of just people that can afford it. How would you respond to a lot of what we see as the kind of standard talking point criticisms of single payer?
Well, first of all, it's true to some degree in a lot of these countries. But on the other hand, a country like France has much lower. All these countries have lower infant mortality and higher life expectancy than we do. So they must be delivering decent care. But it's true there are longer waits in a lot of these places. But for us, that wouldn't have to be so.
Why not?
Because we have excessive facilities. We've developed too many. We have too many CAT scanners. We have too many MRIs. We have too many operating rooms. We have too many specialists doing these things. If we got rid of unnecessary care, there would be extra capacity to do all these things. Not only would people not have to wait for them, they'd have them done faster because there wouldn't be a backlog at all.
So you're saying the reason why that would be different if the U.S. instituted a single-payer plan than what we see anecdotally in Canada, England, France, would be that there's many more facilities per capita than in those countries?
We have excess capacity by far and away compared to all of these. I mean, I can't give you exact numbers, but it's probably at least double or triple what they have in those other countries.
When I think about a single-payer system or universal care, socialized care, whatever name...
I don't like the word socialized care. I don't think it's valid. It's not we don't have to have a government takeover. By the way, we have the insurance companies now determine what things go on rather than government. I'd rather have a centralized expert group of people telling me what to do than having the insurance companies telling me what to do, which is what is happening right now.